Good afternoon, everyone. I am very pleased to be here and presenting preliminary finding of the project work we've been doing until now. Project titled in short, From Policing to Public Health. In terms of agenda, we'll begin with a brief overview about the project, and then I will share with you preliminary findings from the work we've been doing until now. Following that, we'll move to the World Cafe discussion session, where we will be grouped into three tables and dealing with three topics, three questions. And finally, we will conclude and wrap up our discussion by identifying, hopefully, key themes and agree on next steps. These projects represent a collaborative work, not only between Access Alliance and Devonport Community Health Center, but also within Access Alliance, multidisciplinary team, the people you see here working together. This project is, by the way, only 2 months old, and the last 2 months we have covered a lot of ground. The project includes, as you already saw, a principal investigator, but a whole number of project team members as coordinators, as research assistants, as peer researchers, and also as volunteers working on this project equally. One of the very unique things about this project is we all participate equally in this project. They are here as a testimony to attest to that. We all participate equally. The work that we do, the decisions that we make, we do that equally because this is a peer-led research project embedded in community-based research approach, which is different from the traditional research paradigm that you usually know of. Also, just to acknowledge, this project is funded by Ontario Health, and this project is funded by Ontario Health, and we have received ethics board approval to carry out empirical research, which we secured last week. So we are clear to go. Our project has 4 interrelated objectives. The first one is we want to understand how Black children describe their mental health challenge. The second objective is we want to understand the barriers that prevent Black children and their families face in trying to access care for their children and family members. The third objective is to identify gaps in culturally responsive mental health services that are available in this city. And the fourth one, and a very important one, is to collectively explore alternatives to police-led response to crisis that we see time and again in this city. In terms of methodology, this is purely a community-based research. This is a peer-led research process. It's really important that the peer researchers involved in this project make decisions equally as the project lead. Till now, the decisions that we made, including which topics to present today, have been taken collectively. We discussed on it. We agreed which questions to present to the table that we're going to discuss on later on. So this is a peer-led research process. It's a community-based research, grounded in equal power sharing, grounded in working with rather than working on communities when we do research. The project will have 4 components or 3 components, depending on how we define. The first component is conducting a scope review. We want to understand what has been stated and said about Black children mental health in the whole of Canada, not just in the city, but in the whole of Canada. So for that, we established a very rigorous search strategy. I will come to that actually when I talk about the Prisma chart. So the first component is a scoping review. So we looked into peer-reviewed academic articles on this. The second component involves an environmental scan. We deliberately narrowed down the definition of environmental scan to look into gray materials. What have organizations that are providing mental health services to Black children wrote about it? So we looked into their annual report, their policy briefs, their websites. The third and fourth component are empirical research. So we will be, because we got our ethics approval last week, we will be doing 3 focus group discussions and a minimum of 12 interviews. So it has 4 components. Until now, we almost are through with the first 2. So my presentation today in terms of our findings are drawn from the scoping review and environmental scan. As you can see from this, the picture, the Prisma chart here, we followed a rigorous process. I mean, the document that we reviewed for environmental scan, the document that we reviewed through our environmental scan and scoping review went through a rigorous process. So after having designed a search strategy, we consulted 7 big academic databases. We retrieved about 678 articles. Out of that, we removed duplicates. We also looked into organizational reports, policy briefs and websites. We identified about 17 materials or records that went through a screening process. All of us did equally, by the way. All of us did the screening process on confidence equally. And we ended up with 108 articles and 17 gray materials, which we read all of them. So today's presentation, and so this is for the whole of Canada, but today's presentation will be based on 21 articles and 17 gray materials that focus on the city of Toronto. So out of the 108 articles we found, 21 articles discuss Black children use mental health services in the city of Toronto. I will now move on to some of our preliminary findings. The first finding that we found is that our findings suggest important barriers affecting access and navigation barriers, navigation pathways. Discrimination emerged as a chronic stressor affecting Black children using and children, and it has been documented importantly by several studies that we reviewed, but importantly by Mary Senat, as you all know, one of the authorities on Black mental health in Canada. This finding is important because oftentimes discrimination is presented as something you face occasionally, but actually the document we reviewed, the articles we reviewed indicate that actually Black children in use face them regularly, affecting their mental well-being. We also saw, especially a report by Black Creek Community Health Center show that youth mental health stressors are closely connected with structural factors. And this is really important. We can't discuss about mental health in isolation from the context within which we live. Our community are particularly impacted by structures of poverty, unstable housing, unsafe schools, and I'll speak a little bit about this later on, and also exposure to gun violence, especially neighborhood gun violence, which impact on the mental health of children and youth in this city, in particular Black children youth. One other element is, in times of crisis, Black children youth are particularly impacted. As an example, a study by Nobel and his colleagues show that during the COVID-19 pandemic, Black youth, particularly those who are unhoused and those who are newcomers and Two-Spirit LGBTQ, were particularly impacted by mental health and who fell through the cracks in terms of access to services available to them. The other finding is that Black and newcomer families face challenges even before reaching the service points. Again, I'll refer back to a report we reviewed from Regent Park Community Health Center based off the study from 2020. Based off of 178 youths they interviewed for the research, nearly 43% lacked information where to go to seek services. That's a staggering number. That's really a staggering number. And 40% don't even know how to access mental health services. So when you talk about culturally responsive mental health services, when you talk about access, actually, before you even reach that point, there are major issues here. Our review also indicated lack of culturally responsive mental care. This has been said time and again. This has been documented in the report and in academic publications, but we need to state it again. So there are long wait times. There are fragmented systems. There are inconvenient service hours for those seeking services, and lack of nearby services. And our letter will show a map of mental health services distribution in the city, by the way, and high cost associated with seeking private therapy for children use. So these findings suggest that the process of navigating system itself may become an additional challenge for children use and their families. Our presentation or our discussion will not be full without talking about the systemic inequalities and intersectional barriers that Black children use and their families face when they try to access mental health services. One of the key issues that came through from the several documents that we reviewed is structural anti-Black racism, the systemic anti-Black racism, the legacies of colonialism and ableism, which seem to be embedded within the child and youth mental health systems and services. Of particular note, the institutional racism within the education setting, the adultification, the systemic racism, which tend to disproportionately punish children and youth and therefore expose them to lifelong mental health challenge, is highlighted by the studies that we reviewed. And also, and again, very important, our review indicated experiences involving over surveillance, family separation, and culturally inappropriate placement. Another important finding concerns crisis pathways. As most of you are working on in mental health sector, perhaps you know Fante Coleman and Hercules publication as a seminal work. If you want to go further, this is an important work. This study published in 2020 showed that approximately 23% of Black youth enter care involuntarily via law enforcement or through forced hospitalization. Nearly one in four Black youth have their first contact with mental health care through crisis response or through the police encounter with the police rather than through voluntary seeking of help and care. Nearly one in four Black youth is admitted to mental health involuntarily. The significance of this finding extends beyond the number itself because it suggests that the youth who are admitted to care through this pathway likely will have a lifelong traumatic experience, even if they consider wanting to seek similar support. Now, we asked ourselves, why does this kind of pattern persist? And lucky for us, there is a report that came out last week, a report published by Wellesley Institute and the City of Toronto by Gemechu and Fante Coleman again. They point, it's not a full answer, but they point to the data infrastructure in this city. So the report indicates that the city operates on fragmented, siloed race-based data systems across the different divisions. And they argue, without a centralized, transparent, and standardized data, we face massive accountability deficits, even going forward. Perhaps this report came out about a week ago or about 10 days ago, a worth reading report. Based on our review of the document included for review, we also felt we must also turn our lens into the socio-cultural dynamics and the stigma that affect our country. It has been documented enough that among Black, African, Caribbean communities, stigma with regards to mental health is an issue. We often tend to hide it. We often tend to sideline it. We often tend to externalize the problem. There is one document which noted that cultural beliefs minimize mental health struggles, framing them through what Hughes described, and I will quote, "shake it off and go" attitude. So it's not a big problem, it's not an issue, don't bring shame to my family, or perhaps it is because of your weak connection to your faith or your God. Those are the kind of stigma, the kind of sidelining that appear to be part of the issue. On the other side, our review also indicated safety and healing. As an example, the works by Goddard Durant and his colleagues demonstrated that Black youth express significantly stronger trust in community-based, peer-led spaces. They want to be supported in culturally familiar settings that offer belonging rather than judgment. One of the points which I want to emphasize is the context within which mental health challenges occur. Oftentimes, mental health are individualized. They are ascribed to individual weaknesses, individual behavior, individual misdeeds, individual diagnosis. We can't get a full picture until we put in the structural context within which mental health takes place and a lack of services thereof. This is almost a quotation we took from an official report from the City of Toronto published in 2017. Black families are about 3 times more likely to be living in low-income families compared to their white folks. 48% of Black children live in families whose income is less than $30,000 a year, compared to only 9% for non-racialized children. And unemployment rate stands at 13%, perhaps now even higher. Why is this important? Exposure to mental health challenge doesn't just happen over a day. It starts early on and accumulates. Support for mental health should have been or could have been an area where we have equal opportunity for all, but that's not the case. This is just to point to the economic context within which mental health challenges are faced by Black children youth in the city. So we collaborate, as part of this project, we had the pleasure of collaborating with the City of Toronto folks, the Social Development Unit. We also, Marco, thank you very much. You connected us with 211 to have a map of mental health services available in this city. And this map is generated by the City of Toronto for us. We have a printout, we'll put it on the discussion tables, and you will have it with you later on. What we want to show here is, and this is an ongoing project, by the way, this is not yet final, but it's a workable document. We want to see distribution of Black population in the city. And then on top of that, we want to put distribution of mental health services available in the city. Now look at the geography where Black population are significant, and look at the distribution or the concentration of mental health services. At this stage, we cannot speak categorically that there are service deserts or there are service disconnects, but there are messages that can come out when you look at this. West End, part of East End, because most of the mental health services are concentrated in downtown Toronto. The other area I want to talk about and draw your attention to is police involvement in mental health services. Police are, based off of the several documents that we reviewed, police are frequently viewed as a source of concern for the youth, for the children, for the family, and caregivers. Oftentimes, previous trauma from police interaction discourage families from even seeking help, from seeking support. And black male youth describe police interactions as deeply traumatic. These are quotations, by the way. Deeply traumatic experiences involving harassment, violence, and intense fear. This finding is really important. These are really important because they don't just impact your mental well-being at the time of the interaction. It impacts, because it creates trauma, it impacts the way you interact with the police or the justice system, and also your health-seeking behavior later on. But there is a good news. There are some models, alternative to the police-led models, that are working. As an example that we know of, the Toronto Community Crisis Service introduced, after a thorough consultation with community members, is an example. It's a civilian-led model. They did an evaluation of that project after a year of operation, and they showed that actually 78% diversion rate from a police response. So people seeking support, they intervened, they get nearly 80% diversion rate, which means 8 in 10 people were able to enjoy a civilian response rather than a police intervention. I will stop here. For anyone who is interested, this is the list of all the documents we consulted. And the team member here, we reviewed it equally. There is no anyone who say I did more. But anyone who is interested, you can have access to the list of documents that we reviewed.